We're now going to take a look at the organs that help to conduct and store the urine in the urinary system. So we're first going to look at the ureters. Remember, there's two of them, and they conduct urine from the kidney to the bladder. So their anatomy is going to be set up just to assist in that function. So starting from the lumen, so that's the center of the tube, the innermost or deepest layer is the inner mucosa, and it's a transitional epithelium. Remember, the urinary tract is the only organ system in the body that has transitional epithelium. The cells in the stratified epithelium change shape and become larger towards the apical side of the epithelium, and that allows the cells to be able to stretch to accommodate changes or volume changes within the organ. The next layer is smooth muscle. The smooth muscle is here to have the ureter contract as it's stretched, and that causes peristaltic waves that help to keep moving the urine towards the bladder. And then the outer layer is connective tissue, and it's continuous with the peritoneum to help anchor the ureters in place. So if we take a look, this is a ureter. The middle of the hole, or the middle is the hole, that's the lumen. The next layer is the mucosa. It's the transitional epithelium that's going to allow this organ to stretch to accommodate the urine as it comes through. Underneath that is the smooth muscle that allows for peristalsis, and then around that we'll have connective tissue anchoring the ureter. Something that a lot of people are familiar with are kidney stones, or what we call renal calculi. They form from crystals, and they can be caused for a number of different reasons, but larger stones can block the ureters, and it causes a lot of pressure and pain as the urine cannot flow out of the kidney. If we see this picture, you can see here is a kidney stone blocking a minor calyx. Here is one in a major calyx, and here's one in the ureter. That type of abrasion, the transitional epithelium, remember, is there to stretch. It's not a stratified squamous epithelium. It's different, and so it causes a lot of pain as the ureters are stretched beyond what they normally are with just urine. The urinary bladder has a couple pieces of anatomy that we want to be familiar with. The first is rugae, so folds like we've seen in other organs now, and those are there to allow the bladder to expand to accommodate an increase of volume. There's an area called the trigune. It's a triangular area created by the urethra and the ureters on the inferior side of the bladder. The neck is the area surrounding the urethral opening, and it is also surrounded by a sphincter. We call it the internal urethral sphincter, and it's an involuntary smooth muscle. So it's under the control of the autonomic nervous system, and in particular the parasympathetic nervous system. The muscle that we have in the bladder is called the detrusor muscle, and it's smooth muscle, and as it compresses it makes the volume of the bladder smaller, and that's going to cause a reflex to go to the brain, and that's what alerts you that the bladder is starting to fill. So if we look at the bladder, here's the detrusor muscle making up the wall. In the back we can see the rugae, and here on the inferior end is the trigune. So from the urethra to the ureters we have this triangle. Because that's where urine collects, that's normally where we have urinary infections or bladder infections when they take place. On this picture you can see the urethra is surrounded by the prostate gland, and so this is a picture of a male bladder. The other thing that you should note is that the ureters are coming to the inferior posterior side of the bladder. So they don't come to the top of the bladder, they actually come to the bottom. So the bladder fills from the bottom upwards. The last component is the urethra, and that's what's going to conduct the urine out of the body for excretion. And because the urethra opens to the outside of the body, it's lined with a stratified epithelium. It's surrounded by an external urethral sphincter. So This is going to be skeletal muscle, so it is under our voluntary control, and it has to be relaxed to be able to permit urination. There are differences between the male and female urethra. The most obvious is the length. So the female urethra is only 3 to 4 centimeters. The male's is much longer. It's about 19 centimeters. The reason for the difference is that the male urethra comes through the penis as well, and so that increases the length. Because of this difference, the female's bladder is much closer to the outside world, and that's why females are more likely to get bladder infections than males. Another difference is that the male urethra carries both semen and urine, and because the male urethra is going through different organs, we actually have different areas to it. So the urethra in the male, we have the prostatic urethra as it comes through the prostate gland, the membranous urethra as it passes through the urogenital diaphragm, and the spongy urethra as it passes through the penis. To be able to urinate, it's actually a reflex. We call it the micturition reflex. And there's two pathways that are activated at the same time. We have the local pathway and the central pathway. The local pathway is when the urinary bladder starts to fill, it stretches, it signals mechanoreceptors. Those receptors send afferent impulses to the sacral spinal cord, so the bottom part of the spinal cord. And the neurons at that level have sympathetic motor neurons that respond, and they cause the detrusor muscle to contract and compress the bladder. And as it does that, it is going to shrink the volume of the bladder, and it creates more pressure. And so it's a feedback. As the bladder fills, we're going to have more contraction, and that more or increased contraction increases the need to go to the restroom. The central pathway is happening at the same time. So as soon as the local pathway is activated, the central pathway alerts the brain that we have to use the restroom or we have to urinate. So interneurons bring the sensation to the thalamus and to the cerebral cortex. Remember, the cerebral cortex has your voluntary muscle movements there. And so after somebody is potty trained, then they learn to relax their external urethral sphincter on demand. And so as we relax the external urethral sphincter, that's going to cause relaxation of the internal. And once both are opened, then urine will flow. So here we can see the reflex in action. So as the urinary bladder fills, we're going to pick up stretch on mechanoreceptors. That's going to alert the spine, so it's part of the central nervous system. It alerts the spine, and the spine is going to start to contract the detrusor muscle in the bladder. At the same time as this signal comes into the spinal cord, messages are relayed up to the brain, up to our cortex. If it's convenient to go to the restroom, then the cortex is going to send signals to open the external urethral sphincter. That's going to open the internal, and then urine will flow.